Assalamualaikum and good morning. My name is Noor Rafidah binti Kamaruddin, audiologist from Audiology Unit ORL Department Hospital Sungai Buloh. Today, I will be presenting an introduction to hearing assessment. What is an audiologist? Audiologists are healthcare professionals who provide patient-centered care in the prevention, identification, diagnosis, and evidence-based treatment of hearing, balance, and other auditory disorders for people of all ages by American Speech Language Hearing Association (ASHA). The audiologists also provide comprehensive diagnostic and rehabilitative services for all areas of audiology, vestibular, and related disorders. General audiology services include hearing assessment, acoustic emittance, hearing amplification, vestibular, tinnitus, aural rehabilitation, and speech tests. The purpose of hearing assessment is to quantify and qualify hearing in terms of the degree of hearing loss, the type of hearing loss, and the configuration of the hearing loss. Hearing loss in children should be managed as early as possible. This is to ensure that child hearing is adequate for speech and language development. Hearing assessment consists of hearing screening tests and diagnostic hearing tests. What is the difference? Hearing screening test is a quick test that will give a pass or fail result. If the result is a pass, it shows no sign of hearing loss. If fail, required to undergo in-depth hearing test. Diagnostic hearing test is a complete evaluation of hearing. The hearing assessment was conducted using a test battery approach. The basic component of this battery approach is starting with a case history. Audiologists will obtain a case history directed by risk factors associated with the hearing loss. Otoscopic examination. The audiologist will conduct an otoscopic examination in both ears to ensure that ear canal is clear and the tympanic membrane are intact. As the otoscopic examination is cleared, the audiologist will perform an acoustic emittance test on the patient, such as tympanometry test or an acoustic reflex. After that, the complete audiological hearing assessment are performed depending on the patient's age and condition. Finally, after completing all the audiological tests, the audiologist will counsel the patient regarding the degree and the type of hearing loss, the implication of the hearing loss on communication, cognitive, physical, lifestyle, and others. Types of hearing assessment. There are two types of hearing assessment. First, subjective test or behavioral testing. Behavioral hearing tests require the participant to reliably demonstrate a change in behavior when a test sound is heard. Second, objective test. Objective hearing tests require only passive cooperation from the participant. To make it simple, the subjective test require patient response, while the objective test didn't. Subjective test. In the subjective test, there is a distraction test. Distraction test can be performed on children from 6 to 18 months of age. The distraction test is suitable for infants who are able to sit unsupported and have a good head and neck control. The tester will present the sound from the back. After that, observe the child respond. If the child hears the sound, the child will make a head turn to a sound stimulus. This is a video of a distraction test. The tester introduces the sound stimulus at the back of the child, while another tester acts as a distractor, distract the child in front. You can see the child make a head turn when he hears the sound of the stimulus, but must be careful. The distractor cannot distract the child too much. Visual reinforcement audiometry (VRA) is a subjective test. VRA can be performed on children from 6 to 36 months of age. The sound is presented together with the lighted puppet and encourage the child to turn his head to the puppets. The child is trained to look towards a sound source. The most common response to be observed is the child's head turning. Reward the child through a lighted puppet when the child gives a correct response. This is a video of the VRA test. Firstly, the sound stimulus and the lighted puppet were introduced simultaneously. The tester will teach the child to respond to the sound stimulus by making a turn to the lighted puppet. When the child understands the task, automatically the child will make a head turn to the lighted puppet every time the child hears the sound. Play audiometry. Play audiometry can be performed on children from 2.5 to 6 years of age. The child must be mature enough to learn the procedure and wait for an appropriate stimulus. Responses are obtained using simple game activity. Example, such as dropping block in a bucket as a response to the stimulus given. This is a play audiometry test video. We can see the child put the toys into the slot each time the child hears the sound stimulus from the transducer. Pure tone audiometry, PTA. PTA can be performed on older children and adults, a method used to establish hearing threshold sensitivity. The patient is simply asked to respond in some way when the tone is heard from the headphone. Patient will respond by pressing a button or raising their hand. This is a video of the PTA of an adult patient. The instruction was given by the audiologist to the patient. The audiologist instructs the patient to press the button every time the patient heard the sound from the earphone. The testing has started. As you can see from the video, the patient pressed the button every time he heard the sound. This is an example of an audiogram form that was used in our clinic. Usually, all the objective test results were plotted on the audiogram. At the middle of the audiogram form has shown the type of the hearing test that the audiologist performed for every patient. The test is either PTA, play audiometry, or VRA. It also had the type of transducer used as either headphone, HP, insert phone, IP, or free fill. At the bottom of the form also mention the reliability of the patient, either the patient give a good, fair, or poor reliability. Objective test. Auditory brainstem response is a type of objective test. This test will record electrical activity along the auditory pathway in response to the acoustic stimulus up to brainstem level. ABR can be used for hearing screening on babies. Usually, we use an AABR machine, automated auditory brainstem response. Other than that, ABR is used to test the hearing of the hard to test children and babies and the non-organic hearing loss patient. Another application of ABR is the site of lesion testing, for example, to check acoustic neuroma. Need to be careful. If the tumor is too small, you can get a negative finding from the ABR test. On the right side of the slide is a picture of the AABR machine and ABR diagnostic machine. The machine that was used on the baby is called AABR. This machine only gives you pass or refer result. The machine used on the sleeping child is an ABR diagnostic machine. The electrode was placed on the forehead and the mastoid bone. The sound stimulus was given to the ear and the electrical activity was recorded by the ABR machine. And the result was shown in a graph with 1 to 5 were plotted in the graph. Auditory Steady State Response, ASSR. ASSR is an electrophysiological response that is evoked by a rapid auditory stimulus. ASSR typically use a frequency-specific stimulus to create an estimated audiogram and hearing level. Identical to the ABR testing, electrode were placed on the forehead and mastoid bone. Shown in the picture, we can see the plotted estimated audiogram that we get from the ASSR result. Autoacoustic emission, OAE. This test was to determine the function of outer hair cell in the cochlea. OAE can be used as a hearing screening method for babies and to test the hearing of a challenging and uncooperative individual. The OAE equipment can be a screening or a diagnostic OAE. As shown in the picture is an example of a screening OAE machine. The result only show pass or refer result. That's all for today. Thank you for listening.